Repetitive stress injuries, RSIs, also referred to as overuse injuries, repetitive stress and repetitive motion injuries or cumulative trauma are one of the fastest growing occupational injuries, according to the Occupational Safety and Health Administration. Whatever the name, RSIs include many different conditions, like carpal tunnel syndrome, bursitis, tendinitis, trigger finger, rotator cuff syndrome, epicondylitis also called tennis elbow, lower back pain, neck pain, and much more. Any job that requires you sit or stand in the same position for long periods of time or repeatedly perform the same manual tasks puts you at risk for developing an RSI. RSIs often develop gradually, so many workers don't seek diagnosis or treatment until the condition has already taken toll. Left untreated, these types of conditions can become chronic, extremely painful, and debilitating, disabling workers to perform even basic activities of daily living, much less their job duties. When workers have to perform a job task that mismatched for their physical body, it can cause excess strain, wear and tear on the muscles and tendons of that area. For example, if you work on an assembly line and have to constantly stretch or lean across the conveyor belt, it could affect the muscles in your back, arms, and neck, or using a jackhammer at construction site, creating constant vibration and repetitive strain of the muscles, tendons, and ligaments around the joints of your hands and arms as well as your upper and lower back. Your body is not meant to overstretch in an awkward position for hours on end and sustain such repetitive loads. It'll create micro damage to your body's structures that, over time, can lead to conditions such as an RSI. There are many contributory factors that can stimulate and proliferate this conditions, like using vibrating equipment, adopting an awkward posture, holding a static posture for excessive durations, performing forceful movements, working at a repetitive task, using equipment that's poorly designed, working in an environment that's poorly organized or not ergonomically sound, failing to take adequate breaks to allow the muscles to rest, heavy lifting or lifting items that are awkwardly shaped or have a disproportionate weight distribution. Some of the other types of employees who often sustain RSIs include the following: construction workers, manufacturing and assembly line workers, loaders, movers, stock handlers, general transport, trucks and bus drivers, delivery workers, nurses and healthcare workers, bakers, farm, dairy, and field workers, mechanics, restaurant workers, mail carriers, cleaning industry workers, cashiers, butchers and meat packagers, telephone operators, seamstresses, tailors, sewing machine operators, office workers that perform excessive typing, musicians, and professional athletes. The symptoms usually appear gradually. You might first notice them only when you're performing the repetitive job task. They might subside after you've rested a bit. A lot of patients report that the numbness or aches wakes them in the night. If left untreated, the affected area could become inflamed and swollen, and the symptoms will worsen and become constant. Additionally, many patients report developing anxiety and depression because of their physical symptoms. Some useful tips and modifications you can do to reduce your risks of developing an RSI or re-injuring yourself: take micro breaks often. Move around, stretch, and give your muscles a short respite from the task at hand. Use an appropriate tool for the job. For example, if you're in the cleaning industry, use mops and brooms with handles that are long enough. Using too short of a handle will cause you to hunch and lean. If you have to stand for long periods of time, make sure you're standing on rubber mats and try to change your position and weight distribution often. Use proper lifting techniques, reduce the weight and load of the box if possible, squat to pick up, keep the load close to your body, and avoid jerky movements. Also use back support, back brace, for repetitive lifting and carrying. Use a comfortably loose grip on any tools you use. The same applies if you're a truck driver. Keep a relatively loose grip on the wheel to prevent overstraining your hand, wrist, and forearm muscles. Use dollies, carts, or hand trucks when possible. Change tasks often if possible. Be aware of your own level of fitness. But strength and fitness cannot protect your spine from the cumulative traumas of lifting and other risk factors, recommends the National Education Association. If you have to work in cold weather, perform warm-up exercises prior to beginning your shift to reduce muscle strain. And of course, if you start developing any repetitive symptoms, please see your doctor for evaluation and treatment. Early detection and treatment often can prevent you from developing a chronic condition. If you suspect that you're developing an RSI and it's starting to impede your ability to work at full capacity, you do not want to put off getting it checked out. Delaying treatment will only make matters worse and it could cause chronic and irreversible damage. First, see your doctor and get some diagnosis. then you will need to tell your employer of your symptoms and make a report. OHSA requires that employers identify and correct hazards such as those that lead to RSIs. So be open with your employer and tell your supervisor or HR manager about your symptoms. If your condition is work-related, it may be compensable under workers' compensation laws. But, you'll need to inform your employer and file a workers' compensation claim in a timely manner so that all of your doctor's appointments and treatments will be covered. Employer cannot terminate employment or fire an injured worker, it's against the law. Unlike other states that mandate workers use a company doctor for work-related injuries and conditions, New York statutes give workers the right to use a doctor of their choice for their work injuries. However, when you go to the doctor, tell him or her about your work tasks that likely contributed to the injury so that doctor will document the work-related nature of your condition. It's important to find a doctor who is competent to diagnose and treat RSI. Some doctors doubt the existence of RSI, and many others dismiss it as an insignificant problem. Some doctors don't know the first thing about treatment, while others just prescribe medications or encourage their patients to undergo unnecessary and possibly dangerous surgery in hope of a quick fix. With that in mind, you must do your research and be selective when choosing a physician. Diagnosis for RSIs can be tricky because there are no specific testing methods for these types of soft tissue injuries. Muscle strain and reasons for pain often don't show up on an MRI or CT scan. Rather, doctors have to use the patient's symptoms, medical history, proper physical examination, and observation. Challenges to RSI workers' compensation claims. Many employees run into problems with their workers' compensation benefits when they file a claim because of RSIs. First, like many soft tissue injuries, some types of RSIs are difficult to medically substantiate and doctors rely on patients' reports of injury and symptoms for diagnosis. Make sure you provide your doctor with detailed history of your symptoms and details of your work environment and routines that causing your injuries and pain. With enough medical evidence and good legal counsel, it can be successfully achieved. Another problem that arises is with demonstrating the cause of your condition. In order to qualify for workers' compensation benefits, your condition must be related to your job. Because multiple factors can contribute to the development of an RSI, employers often dismiss workers' claims using the justification that the workers' injuries are not work-related in nature. It will be up to the employee to prove that there is a link between their job duties and condition. Yet another factor that complicates claims is procrastination. Workers often wait too long to seek help and report their injuries. With RSIs, many workers try to shake off the symptoms, hoping they'll just go away and that the pain will subside. But be warned that you may not qualify for benefits if you wait too long to report an injury and file your claim. This is why it's essential to tell your employer about your symptoms and get checked out by the doctor as soon as you start noticing that something is wrong. This way, you can get the treatment you need and deserve as well as the benefits to cover your expenses. Get professional legal help to secure your benefits. If you developed a repetitive stress injury or other condition related to your job, you should qualify for benefits. But as noted above, it's not always that easy or straightforward. Many workers benefit from getting an attorney to help them navigate the workers' compensation claims process and handle any obstacles that arise along the way, like challenges to the severity of the injury or whether it is work-related. A knowledgeable attorney can make sure you have enough evidence to prove your claim and secure the benefits you need. For more information regarding repetitive stress injuries, please feel free to contact us. You can also find information and helpful tips on many other topics by visiting our website,